Hi, my name is Megan Derhammer, and I'm a student nurse here at Cedar Crest College. Today I'd like to talk to you all about the effects of music therapy on dementia, or on patients suffering with dementia. This topic is very personal for me as I've had family members suffering with dementia, and so I was very interested to see what the research had to say about this. As a nurse, you may be taking care of this patient suffering with dementia in a long-term care facility, or you may be taking care of them in the emergency department as well as the medical surgical unit. And this patient may suffer from an agitated episode. So as a nurse, you can use your critical thinking to not only prevent, but to monitor these patients to see when they are exhibiting signs of agitation. So the goal for patients suffering with dementia is to increase the quality of life as well as maximize their current function. So for my literary search, I used the databases PubMed, Google Scholar, and Cochrane. I used the search, I searched for full text journal articles with relevance to nursing, and I limited that to years between 2011 and 2016. I used keywords agitation, dementia, mood, Alzheimer's disease, music, and music therapy. The three studies that I chose to evaluate, the first was by Gardner. The purpose was to evaluate the effectiveness of individualized music on people with dementia. This was a pilot study, and it evaluated 8 people with moderate to severe dementia in a long-term care facility. The results showed that there was a reduction of agitation during music overall, as well as during day shift hours in the weeks 1 through 8 and evening shift hours in weeks 5 through 8. The second study that I chose was by Witzke et al. And this was a qualitative review. There was 11 studies. 6 of them were completed in the United States. The rest were outside the United States, but they were broken down individually so you could tell which ones were within the United States, which is why it was chosen. And this was chosen because it evaluates if music intervention decreases the need for physical and chemical restraints. The results of this study showed that 9 of the studies had reported reduction in agitation with music intervention. The third study by Kono et al. Was to talk about resistance and care behavior. It was a review of quantitative studies. There were 19 studies, and the sample size for these studies ranged from 7 to 127 people. This showed that there was a decrease in agitation and resistance to care behaviors when music was played during personal care, such as bathing. So for the recommendations for practice, the first would be to implement music 30 minutes prior to and during peak agitation times, as well as during care activities. In an article by Park, the common peak agitation times evaluated were 2 p.m. to 4 p.m. And based on the evidence, music does decrease agitation. So by implementing this during those times, there would be a likelihood of there being a decreased agitation. And also by the study by Kono et al. Showing that there would be a decrease in agitation during the care activities. That's why that would also be a recommendation, because having less agitated experiences would improve quality. The second would be to evaluate for individualized music preference. This would include a lot of family intervention to evaluate what the patient enjoyed prior to cognitive decline. And then provide patients with headphones to use when listening to music in public care areas, as well as assessing everybody for agitation. According to some studies, the headphone implementation would help to decrease negative effects on other patients who suffer from dementia. And according to a study by Gardner, when using the music intervention, you want to do a continued assessment on everybody. So for the conclusion, after the 3 studies that were retrieved, evidence shows that music, the implementation of music, is a therapeutic and non-invasive nursing intervention that has been proven to decrease agitation in patients suffering from dementia. Thank you.